carry last.
You don't hear say Lashma don't bring V-Boot come with market.
Now who be Lashma?
Lashma na Lagos State Health Management Agency. People will bring ILERA EKO.
Oh, okay. The social health insurance people. But what you come consign us with V-Boot?
Caro. V-Boot na the online store where subscribers fit get telephone healthcare talk with Dokita. Dem don station all these V-Boot stores them for all the big area markets throughout Lagos. People wey don already pay down for the standard Jara plan go enjoy all the better benefits of the old standard plan together with the new extra jolliment.
Abeg, tell me say this talk na true.
Just dial *6700 *006 # to join standard Jara one time or call 0700 ILERA EKO. You fit also send WhatsApp message to 0704 535 8275 or register online for www.lashma.com. ILERA EKO, nobody go carry last.
Good morning and welcome, Lagos. It's time for ILERA EKO Extra right here on Lagos Traffic Radio 96.1 FM. Of course, today, like every other Monday, I'm always excited to explore the various, the various ways by which the Lagos State government, through the Lagos State Health Management Agency, is, making efforts to make sure we Lagosians have access to quality health care, yes, accessible to all Lagosians. As a renowned physician, Dr. Atul Gawande once said, the purpose of medicine is to relieve suffering, not just to cure disease. In line with Governor Babajide Sanwo-Olu's vision, we had an upgrade, so to say, on the plans on ILERA EKO. So on July the 16th of July 2024, the ILERA EKO Standard Jara Plan was launched to provide comprehensive healthcare coverage to residents of Lagos. And for a couple of weeks, we have, been throwing our searchlight on that, doing our best, right, from this end to make sure you out there, dear listener, understands why this had to be and what you get to gain and enjoy from this new upgrade. There's a whole range of benefits you get, including access to telemedicine services, annual wellness checks, ENT specialist consultations, cataract extraction surgery, and it's for a very affordable premium. Okay, so we're going to be talking all that. So I'm not the expert, I'm just giving you an overview. Joining us today is our guest, yes, and she would be doing justice to this. We have Mrs. Abosede Adewale. She is the Assistant Divisional Coordinator, Ikeja Division, Lashma. She'll be sharing her expertise on this plan, and any other questions you have would also be entertaining them. You are very welcome. You're welcome.
Good morning.
Good morning. Like I was asking behind the scenes, I hope there wasn't much traffic coming in.
Not really.
Not really. Okay, great. So it's so good to have you on the show. I think the last time we had you on air, it was it physical or via phone lines? I think Was it via
The first.
The first, okay.
Was via phone.
via phone line? Okay, after then we had you for physical.
Physical.
So this is like the third time. Yes. So three is a number of completion. So I believe we're going to have a great show. So dear listener, I would very much appreciate your calls. I would love to hear from you. We value your feedback. We value your questions because that helps us serve you better, talking about Lashma. So please do well to call while the show is on 080-991-20777. That is 080-991-20777. That is also our WhatsApp line. You can also call 091-538-77127. We also have some giveaways. Okay, we would also be giving away 1,000 naira free recharge cards. Yes, our giveaway is back. So we're doing that to the first two callers who answer. So it's not just to any caller. You'll be answering questions. So we have. They're already calling. Allow me. I'll ask questions. I'm asking questions. So the first two callers who answer our ILERA EKO quiz questions correctly. Very, very simple. And they'll all be based on our discussion for today. So do me one favor. Just stay tuned and keep listening. Okay, so we'll do that. So straight away, our guest, Mrs. Bosede Adewale, she'll be doing justice to the question. So today we're talking. Most of our attention will be on the ILERA EKO Standard JARA Health Insurance Plan. And straight away, Mrs. Adewale. So first of all, like I already mentioned, that on the 16th of July, Mr. Governor launched this new health insurance plan. So just help us, make sense of this. What is ILERA EKO Standard JARA Health Insurance Plan? What is it all about?
In brief, Standard JARA, even from the name, Standard JARA, it is not all about the JARA. We've added enough of efficacy ingredients to make it more extra. So I can say it's an upgraded standard plan with more benefits. More Standard JARA, more JARA.
Upgraded standard plan
with more benefits.
Okay. So we seem to have a caller. Let's see if we can just take this real quick. Hello, good morning.
Yeah, good morning.
Good morning. So who do we have on the line?
This is Mr. Karajai from Majority.
Could you take this is who?
Mr. Karajai from Majority.
Okay, Mr. Karajai from Ajao Estate. Okay, please go on. Great to have you on the show. Please go on.
Yeah, I want to commend the effort of the Hospital and ILERA EKO.
Okay.
But we have been on this platform for like 3 years now.
Okay.
And we're about to renew this period.
Okay.
But sometimes last year I called that the 25th of every month.
Yes.
That anything after that will not be effective till the following subsequent, not the following month, but the upper month.
Yes.
So and I was told that maybe they are going to work on it so that at least maybe the timeline will be extended. But since last week I've been on them in terms of how we can make the payment, but I still want to call again if they can extend that 25 of every month till around 27, 28. So to give room for people that want to benefit from the platform.
Okay.
Then the second question I want to ask is that for some years now, some of the hospitals, some of my staff use.
Yes.
The hospital always complain. They have to give them maybe a letter or something like a prescribed drug to go to any nearby pharmacies for the drug.
Yes.
But unfortunately, if they get to the pharmacy, they'll be told that they don't have the drug. They have to refer them to another place. Someone that is sick, now move from one place to another to get the drug. It's not good and not convenient enough. So why can't the hospital now be giving them the drug just to ease the staff stress?
All right. So those are your two questions.
Yeah, and also please, the other one is that some hospitals don't have lab and they are in the ILERA EKO facility. So how can this be resolved?
Okay, some hospitals don't have labs. So how can that? Yes, okay. Okay. All right. Okay. So, if I get you correctly, the first question, your first observation, so to say, was about the fact that you were told that once it's anything beyond 25th, you were told that you have to. If you register after, if you renew after 25, you have to wait until the new month, the upper month.
Yeah.
Subsequent month.
Okay, and you want to know if something can be done about it, right?
Yes.
Okay, and then your second question was about the fact that your
Prescribed drugs.
yes, prescribed drugs, and they have to when they're sick, and it's not nice that they are going up and down to different. Okay. Okay, and that some hospitals don't they don't have labs. Okay, thank you very much. I believe my guests should be able to respond to some, and then for the rest, I believe something will be done about that. Thank you very much, Mr. Kalejai. Do expect a call after the show. Thank you so much.
Okay.
Yes, well done. All right, so would you want to respond to?
Yes, I would. Thank you, Mr. Kalejai, for the appraiser. So I would like to talk on the referral to the community pharmacy.
Okay.
So I would advise anytime you are referred to the community pharmacy to get your drugs, make sure when you are experiencing any itch, make sure you call our call center lines so that it can be resolved while you are still there. Thank you.
Okay, and the 25th, the issue of the 25th, I think a few people do not really understand that policy. So could you just take us through that and just explain?
Yes, it's the subscription dates, the terms and conditions
Yes.
for the subscription is 25th of the current month.
Okay.
So when you don't meet up with the 25th of that current month and you pay after, then you have to wait for subsequent months.
Okay.
In the case of the extension that Mr. Kalejai is talking about, then we would call him after the show and
talk
something
about
will be
that.
done about that.
Okay,
from
okay. All right. Okay, so let's come back to ILERA EKO's standard JARA plan. But before I do that, I seem to have a question here, and this one. Good morning, Mr. Akan, and the guest from ILERA EKO. Please, I want to know if Lasuth is one of the hospitals one can select. I want to change from my hospital at Harvey Road to Lasuth. Yes, so let's see. Is that possible? Is that possible?
Yes, you can change your hospital.
But the hospital he's mentioning, is that is that possible? Or does he have? Is there a list where he can go check and confirm? Is maybe
yes.
After
the show, we'll get this the person's details, the contact details.
Okay. So we'll do that. Okay, so we'll do that at the end of the show. Lasuth, we'll take note of this question. I've already, we've taken note of that. You want to know if Lasuth is one of the hospitals that can be selected on the hospital list. So you want to change your hospital, but for someone who wants to change the hospital, what's the process? To do that? What's the process?
Yes, so to change your hospital, you have to send a mail.
Okay.
To ileraeko@lashma.com.
ileraeko@lashma.com.
Yes,
okay.
for change of hospital.
Okay, address to
ileraeko@lashma.com.
Okay.
Then the subject's change of hospital. In the body, you have to include your name,
okay,
your policy number,
okay,
your registered hospital,
okay,
and the new hospital you want to change to.
All right. We have another call. Oh, we lost that. Do call back so we can get your question. Thank you so much. Much later in the show, I will be, giving out, doing some giveaways we'll be doing some quiz questions. But right now, we're talking about the ILERA EKO standard JARA plan. Okay, so let's talk about the benefits. At the beginning of the show, I mentioned a bit, but I believe you should be able to, go into a bit of more detail. So let's talk about that. What are the benefits and the coverage?
Thank you. We have the annual screening now. Annual medical screening.
Okay.
Then we also have cataract extraction surgery.
Okay.
We have the mental health.
Okay.
Telemedicine.
And this wasn't on some of the other plans.
Yes.
Okay.
We have the ENT. The ear, nose, and throat.
Okay.
Consultation.
Okay.
Specialist consultation. We have orthopedic treatments.
Okay.
cardiology.
Telemedicine. For those who, want to access that, some people do not even know what telemedicine is. Just tell us a bit about that and how it works and how one can, enjoy that.
To a doctor.
Okay.
We have a contact line for that.
Okay.
In which you can explain to the doctor via phone.
Okay.
How you are feeling. Then through phone, they can prescribe drugs to be used for you.
Okay. All over the phone line.
Yes.
Okay. That's great. So take us through the registration and enrollment process. How can we get to register and be a part of this? How does that work?
Yes, we can register via our Ibile divisional offices.
Okay.
At Ikeja, there's a Badagry, Epe, Ikorodu, Lagos.
Okay.
And we can also
can I have
register
those details if possible?
We can also register through our kiosk at the grassroots level.
Grassroots levels, okay. So how much will residents, or how much do residents need to pay for this this particular plan that we're talking about? I know a few people are wondering, with all the goodies you have mentioned, which for those who know about the other plans, some of these benefits do not come along with. So this is like an upgrade. That's why you already mentioned that it's a JARA plan. So let's talk about the premium. How much will we pay for the plan?
Yeah, for the cost application for the individual plan is 15,000.
15,000
per annum.
Per annum, okay.
Then we have family size of 4.
Okay. A
which
family
is
of 4, okay.
yes, a father, mother, and 2 children.
Okay.
Which is 55,000.
Okay.
And a family size of 6 members.
Okay.
Father, mother, and 4 children.
Okay.
80,000.
80,000, okay.
The dependent shouldn't be more than 23 years of age.
All right. Okay. So for the other plans, I know there was an arrangement where you could pay small. Do we have this for standard JARA?
Of course.
Okay. So can we possibly know how much that would cost us?
Yes, from quarterly. We can pay quarterly and we can pay semi-annual.
Okay, quarterly, that's every 3 months.
Yes.
And then every 6 months.
6 months.
Okay.
For the individual plan of 15,000 per annum, the quarterly plan is 8,000.
Okay. For that's quarterly.
The semi-annual is 8,000.
8,000. Okay, that's every 6 months.
6 months.
Okay,
then the quarterly plan is 4,125. Yes.
Okay, so if I pay 4,000 naira,
4,125.
Okay. So it's been a great time on the show, dear listener. I see that a few of you were trying to connect. I don't know what exactly the issue is with the connection, but I believe at this point in time you can call back to ask your questions. Meanwhile, I will be opening up the phone lines if you want to also, try any of our quiz questions. Everything will be based on what we have discussed so far, so you have nothing to fear. Meanwhile, for those who have been following the show from the very beginning, we actually played an announcement, so to say, an ad about the V-Boot, ILERA EKO V-Boot. And I know a few people, when they hear that, for some who have not been following the show, they'll be wondering what is the V-Boot, what is ILERA EKO V-Boot, and what the connection is with this new plan, the ILERA EKO Standard JARA. So can we know the connection between both? And then after that, we'll start taking calls. I see a few people are already trying to call. Let's just know what that is. What is the connection?
Yes, there is a connection. This is to bring the healthcare service closer to people.
Okay.
Particularly, it is useful for people at the, let me say, at the grassroots level, the informal sectors.
Informal sector, okay.
It is also the formal sectors too can access this.
Okay.
But particularly for the informal sectors, the market men and women,
okay,
who feel it's reluctant to travel down to their hospitals.
Okay.
So the V-Boot is like the first line
okay,
service they can access.
All right. Okay, so that's the first line. So now you mentioned the present locations. Where are they located?
Yes, we have 5 different locations presently. We have at a K2 bus stop.
Okay.
We also have at
K2 bus stop, okay?
Yes, at K2.
Okay.
We also have it at Adamo
Okay.
Market, Ikorodu.
Okay.
We have at Sabo Yaba.
Sabo Yaba, okay.
Yes, we have at Ayetoru in Ekpe.
Okay.
And we have at Sabo Ikorodu.
Sabo Ikorodu. Okay. Sabo. So there are 2 Sabos in the list. So going forward, I believe there will be more V-boots that will be set up in other locations. But will they only be situated around markets? Let's take this call. Oh, there. I see people are trying to call. I don't know what.
My name is Latif.
Latif. Where is Latif calling from?
Latif Ayodeji from Songo.
From Songo. Latif Ayodeji from Songo. Okay. Mr. Latif, do you have any question first of all?
Not really. Let me tell you.
My quiz. So you're just calling because of the quiz. Hey, see these people.
No, she actually explained everything.
She has explained everything. Okay, thank God that you were listening. But you live in.
Since have you subscribed? Have you subscribed to ILERA EKO Standard Jara?
No.
No.
You need to subscribe. You don't have to miss this opportunity because you are staying in Songo.
Mm-hmm.
We have hospitals around that border
Alakuko.
Yes, that you
RJ,
can. It
thereabouts.
is easily. You can easily walk there to access care. So you have to subscribe.
Okay.
You subscribe to ILERA EKO Standard Jara.
So, Mr. Latif, with what you just heard about ILERA EKO Standard Jara, choose from number 1 to number 5, and let me ask you my question.
Number 2.
Number 2. Okay. Very, very simple. Very, very simple. When this question. It's too easy. It's too easy. It's like people just want to just get money. I don't know. Okay, so which type of health insurance plan can you register on to have access to the ILERA EKO telemedicine service? What type of health insurance plan can you register on to access the telemedicine service? Very, very easy.
I don't quite understand because I mentioned ENT, cataract.
Yes, those are other things you can enjoy. So telemedicine service is also one service that can be enjoyed. So what is the name of that health insurance plan that you need to register on to have access to telemedicine? Mr. Latif, no for my hand.
Well, I have mentioned that.
Even she mentioned it just now. She just met. Oh God.
Is this the annual plan? The annual 15,000.
Oh, Mr. Latif. It's the ILERA EKO Standard Jara plan that we have been talking about. ILERA EKO Standard Jara plan. So those other things we mentioned, you can enjoy them. Also, you can have access to ILERA EKO telemedicine service. I cannot give you this. I cannot give you. May you try again. Thank you so much for calling. Number 2 is gone. So we have number 1, number 3, number 4, and number 5. 080-991-20. Saying about this. But a few people are already on ILERA EKO standard plan, and we have people on the standard plus. And you know, we've been getting questions. People want to know if they can, port to the standard Jara plan. Is that possible?
Yes, it is very possible.
Okay. Are we in a position right now to know how to go about it? Is it possible?
Yes. Once either of the plan that you have on, then after the expiry, you have to upgrade.
Oh, you have to wait until the expiration.
Yes.
All right, let's take this call. Oh, they lost that. You can continue. So, what if maybe my plan would... okay, another call. Hello, good morning.
Good morning, sir.
Okay, who are we on to?
This is Dr. Busari.
Oh, Dr. Busari, you asked the question on WhatsApp earlier, right?
Exactly, yes. Yes, I had problem with my tooth.
Okay.
And I was referred to last week.
Okay.
So, by the time I got there, they told me I should do X-ray.
Okay.
So each tooth, I had to pay for each tooth or to do the X-ray. And apart from that, if I tell you the amount, So that's why I want to see if I can transfer my company to Lassus.
To Lassus. Okay, thank you very
because
much.
They had one of the teeth filled up.
Okay.
Then another one was to be removed or something, and then gave me another appointment for the 30th of September.
And
so I'm going to have a road.
okay.
So I want to at least transfer it to Lassus.
To Lassus.
Thank you.
Okay, thank you very much for this. Would you want to try any of our questions?
Okay, let me try.
Okay, I have number 1, number 3, number 4, and number 5.
Can I have number 1, please?
Number 1, okay, very, very, very straightforward. So when was ILERA EKO Standard JARA Health Insurance Plan launched by Mr. Governor? We talked about it today. We mentioned the date. I need a particular date. When was it launched by Mr. Governor? ILERA EKO Standard JARA.
I remember you saying July 15th this year.
Try again. July. You're very close.
Wow. Is it July 16th?
Yes, July 16th. July 16th. July 16th. July 16th. Oh, wonderful, 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 wonderful. Yes. So I'm so glad that someone actually won it. So you just got that correctly.
Thank you very much.
All right, so Dr. Busari, definitely you will be reached out as our first winner. So number 1, number 2 is gone, and we're still talking about the standard JARA plan. How well do you know the standard JARA plan? Are you already on the standard JARA plan? Let's test your knowledge even as we discuss about this amazing new plan, which is the best of at least everything. For those who want to enjoy the annual checkups, who wants the ENT. Now, Dr. Busari was actually talking about his teeth. That's something that I think the dental is actually covered and all that. We have this call. Hello, good morning.
Good morning.
Yeah, so who are we on to? Who are we speaking with?
My name is Adura Agbemi.
Adura Agbemi, welcome. It's great to have you on the show. Okay, so do you have a question?
I'm visually impaired. I just want to ask if I refer to ILERA EKO Standard JARA.
Yeah.
Will I be getting my eye drop at all? Like anytime I need eye drop.
Will you be getting eye drops? Okay, I think my guests would respond to that.
Yeah, but I want to answer the question.
Okay, my questions. Okay, so 1 and 2 is already gone. I just have 3, 4, 5. What?
Number 3.
Number 3. Okay, so how much is the standard JARA plan for an individual? So how much is standard JARA plan premium for an individual annually? So for a year, standard JARA plan individual. How much is it for a year?
Let me see. It's 16,000.
Ma? Sir?
16,000.
Did you say one? Did you say 16?
Yeah.
16.
Yeah.
16 or 15? Is it 15? Are you saying 15 or 16?
I think okay, 15.
15 your final answer? Final answer? Do you want to phone a friend? All right, Adura Agbemi, you got it correctly. Congratulations.
Thank you.
15,000 naira is the standard JARA plan.
For the question.
Yes, premium. Yes, so it's my guest will respond to that. Just listen over the radio in case so that someone else can call before we round things up. So
yes.
You respond to this?
To the question of Mr. Adura Agbemi.
Yes.
You get eye drop depending on the kind of ailments they are treating at the hospital. In our standard JARA benefits, it is stated there, like a parasitic, allergic. So if it is something like allergic, so you should be able to get your eye drop.
Okay.
For the treatment.
All right, so I'm only doing free recharge card for the first two callers who. Okay, so we have first 2 callers. Are we giving for the first 2 callers questions? Yes, just first 2 winners. Let's put it that way. First 2 winners. So I already have my 2 winners. So let's just stop it at that. Because I see a lot of calls. If you're calling me, I'm just taking your questions. Okay, I'm just taking your questions. I hope that sorts it. So for the eye, he can actually access that. Okay. So before I let you go, I just want you to say a few things to Lagosians as regards the standard JARA plan, and also let's have some contact numbers, contact details that we can reach out to in case we need some more information as regards this. Yeah, let's go on. Any All right, so let's have those. All right, so let's have those numbers real quick.
The ILERA EKO sales hotline.
Yes.
It's 0700.
Okay, 0700. Okay.
453.
453.
723.
723.
56.
56. Okay.
And you can also reach out through 080.
Okay.
84.
Okay.
38.
38.
57.
Okay.
48.
Okay. Okay, those are the two numbers we can call. Okay, so Faloma, I think you wanted to drop your own line in case anyone wants to reach out to you.
Yes, that's a 080 84 38 57 48.
Okay, and anybody who wants any information as regards this can reach out to that number and they'll be attended to. All right, so even as we bring things to a close, a quick look at the traffic situation real quick. Around the Ikorodu Road stretch, NU filling station at Owode Oniri, inwards journey Owode Lady. I understand they're dispensing fuel right now, and motorists trying to queue for fuel have occupied about 50% of the road at the moment. The traffic gridlock has extended all the way back to Irawo. But of course, we have traffic movement. All right, Mrs. Adewale. So let's just take your final words to Lagosians as regards ILERA EKO standard JARA plan. And
like it's always said that you don't wait for the storm before you buy the umbrella.
Indeed.
Secure your health with ILERA EKO standard JARA before illness strikes. You need to prepare and be proactive about your health before it is too late. May it not be too late for us.
Amen. Thank you, Mrs. Adewale, for coming around and taking time out of your busy schedule, to come, shed light on this particular new plan, which, of course, I feel is the very best. Dear listener, as the saying goes, a healthy nation is a wealthy nation. I hope you now have a better understanding of this very incredible initiative. And Oteri, also big thank you to Adenka Bimibadi, PAO Public Affairs Officer Lashma. And this show will make a return, same time, same station next week. Do remember, quality healthcare is just a step away with the ILERA EKO standard JARA plan, the newest from Lashma. Yes, so stay healthy, stay informed. See you next week. My name is Akan.